Ask any expectant mom. She's eagerly waiting for the day to hold her newborn in her arms. She's waiting for her due date. So, hello everyone, I'm Dr. Anjali Kumar. I'm a gynecologist and obstetrician, and I bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. So today, let's understand the very basics of pregnancy, which is how to calculate your due date. A lot of us assume that a pregnancy is exactly 9 months long, but that's not the case. A typical pregnancy lasts on an average 280 days or 40 weeks starting from the first day of the last menstrual period as day 1. By the way, most of the doctors like to calculate the age of pregnancy in weeks.
But doctor, why do we count the duration of pregnancy from the first day of LMP? I got conceived in the middle of the cycle. I can even tell you my conception date.
That's all right. In a 28 days cycle, on day 1 of the period, the egg starts to form in one of the ovaries. When it ovulates and it gets fertilized, it is already 2 weeks old, and when you miss your period, your pregnancy is already 4 weeks old. That's why when you miss your period, now the second month has already started and your pregnancy is already 4 weeks old. How can I calculate my due date? So the due date is nothing but when you complete 40 weeks. It may not actually match with the exact date of delivery also. So there are 2 methods to calculate the due date. The first method. So for this, you first determine or remember the first day of your last menstrual period. Now count back 3 calendar months from that date and then add 1 year and 7 days to that date. For example, if your last menstrual period began on September 9, 2022, now counting back 3 calendar months would be June 9th, 2022. Adding 1 year and 7 days would now bring it to June 16th, 2023 as your estimated due date. This 3-step method is called as Naegele's rule, and it is based on a normal 28 days menstrual cycle. If your cycle is longer, the estimated due date will be later. If you have a shorter cycle, then your due date will be earlier. So the second method, which I find is a little easier, you simply add 9 months and 7 days to your last menstrual period. Once again, for example, if your LMP was on 9 September 2022, now you add simply 9 months and 7 days. So your due date is 16th June 2023. In case you still have difficulty, most of the pregnancy websites have calculators to calculate your due date. I don't remember my LMP and my periods are irregular. How do I calculate my due date? So for people where the cycles are irregular and they do not remember their LMP, I understand it can be little difficult. So we have 2-3 methods there to help us. Number 1 is the ultrasound. So if you do not remember your LMP, we will have to depend on the first ultrasound scan to calculate the exact age of pregnancy. That's why it is called the dating scan. The earlier in pregnancy this scan is done, the more accurate it is to calculate the age of pregnancy and the due date. Remember, always due date is nothing but when you complete your 40 weeks. Second method, conception date. You can also use your conception date to calculate the due date. So in case you've been tracking your ovulation symptoms or you have been using the ovulation testing strips, then You may be able to use your conception date to calculate your pregnancy due date. Just add 266 days to get your estimated due date. In case you had an IVF, so then in that case, if you conceive through the IVF, then you can calculate your due date using your IVF transfer date, which is the embryo transfer date. So most embryo transfers occur either 3 days or 5 days after the egg retrieval and fertilization. So if you had a day 3 transfer, you can count to 63 days from the transfer date to calculate your due date. And if you had a 5 days transfer, then you have to add 261 days to the date of the transfer. Fourth, by doing a HCG test. So what is HCG? HCG is human chorionic gonadotrophin. This is a pregnancy hormone which is detected when you do a home urine pregnancy test. These kits can pick up the pregnancy by almost 4 weeks of pregnancy, which is when you just miss a period. While the blood test for the HCG can even pick up the pregnancy at 3 to 4 weeks of pregnancy, which is even before you miss a period in many cases. So the earliest detection of the HCG hormone in the urine or the blood can roughly estimate the age of the pregnancy and hence your due date. Also, the value of HCG on the blood test can also help us to calculate what is the age of the pregnancy. Is my due date going to be my exact date of delivery? No, not really. Do you know only 4% women actually deliver on their due dates? Remember, once again, your due date is nothing but it is when you complete 40 weeks. A woman most likely delivers anytime between 37 to 41 or maybe 42 weeks. There could also be some women who might deliver early, which is the premature labor. Many times your doctor might decide to deliver you at 37 or 38 or 39 weeks due to some medical reasons by planning for inducing the labor or planning an elective cesarean section. In that case, your actual delivery date obviously will not correspond with your due date calculated earlier. My due date keeps changing on the ultrasound. Yes, it is absolutely true and possible. Each time you go for the scan, the ultrasound comes up with another EDD. Once again, remember, the EDD is nothing but when you complete 40 weeks. The ultrasound calculates the age of the pregnancy by the measured size of the baby on the scan. The software in the ultrasound machine calculates the due date based on the measured size as to when your baby will be 40 weeks based on its size. Can I plan my due date even before getting pregnant? So some people like to be organized and there's nothing wrong with that. But it can be quite tricky to plan a due date because there are so many factors at play with conception that you do not have control over. Nobody ever knows for sure when they will conceive. Even if you pinpoint your fertile window and have plenty of unprotected sex during that time, you still won't know that for sure whether in that month you will become pregnant or not. So while you might want to plan a baby in a certain month, all you can just do is to try. And even if you manage to conceive at a time that gives you your ideal due date, remember that your EDD is just an estimate. Babies come on their own schedule. While the average pregnancy lasts 40 weeks from the date of LMP, it's normal for the babies to come anywhere between 37 to 42 weeks. So it's best not to focus too much on a specific due date. So when someone is pregnant in the family, everyone is waiting for the grand finale. Remember, the due date is not always the D date. Now, whichever date your baby decides to come, there is nothing more special and more auspicious than that. So today, like always, if you found this information useful and interesting, do not forget to share this video with your friends, especially who are on their family way. And do not forget to like, share and subscribe to Maitri, and I will see you soon.